I want to talk to you today about about the role of anesthesia in your surgery. When you come to see anesthesia prior to your surgical experience, you will have already discussed this at length with your surgeon and other physicians, and you will be well acquainted with what is going to take place surgically. I would like to interact this evening with you concerning our role, both pre-intraoperatively and our role post-operatively till you are transferred from the recovery room. For this, you will have general anesthesia, and we tend to use a combined technique in 3 stages: induction, maintenance, and emergence. For the induction, many people ask us what medicines we'll use or what kind of anesthesia you're going to get, and we will be using a general anesthesia all through your intravenous, which will be started prior to your surgery and prior to coming to the operating room. Once you come to the operating room, you will find that you'll be checked in by the nurse, as mentioned previously. You will also be placed on the operating table, and that is when we will start the anesthesia. The anesthetic management for this procedure is complex because the surgery for the procedure is complex. It's an aggressive approach to your surgical disease, and also because of the bleeding requirements and the surgical resections that may occur. Also hyperthermia related to the chemotherapy and your other comorbid medical conditions that may also be present. When you come to see us preoperatively, we'll find that it's a time for us to interact and time for us to find out about your health and you to ask questions concerning your anesthetic management. It's a time to gather information for us to take a history of your medical condition, perhaps examine certain parts, discuss with you lab tests and other tests that you have had done concerning your surgery. After we have taken this into account and we've talked about your medical health, we want to formulate an anesthetic plan and give you an idea what will take place when you come to the operating room and also immediately after your surgery. We're going to discuss the type of monitoring that will be used. We would like to touch on the pain management and also some complications that may occur during your surgery. Now, what is the importance of monitoring and also the different types of monitoring that we will use? The importance of monitoring is to allow us to measure and collect physiological information concerning your heart and lungs and kidneys, and this will provide us with the information to make decisions on the depth of anesthesia, to make therapeutic decisions and use appropriate medications throughout the course of your surgery, and also to replace fluid and blood products in a timely and effective manner. We use this information to interact with the surgeon who's doing the case, and we are always making changes throughout the course of your lengthy surgery. So there are 2 types of monitoring that you will encounter. One is routine monitoring, and the other will be invasive monitoring. The routine monitoring will be that you would encounter in most types of surgeries in most hospitals, and include an EKG, which we will use to monitor the rhythm of your heart, a blood pressure cuff, a probe that will fit on your finger to measure the amount of oxygen circulating in your blood. We have what we call a BIS monitor, which is bispectral analysis monitoring, which is a strip that will be placed on your forehead, and this allows us to monitor in a way the depth of anesthesia. You will have a urinary catheter placed by the surgical team. We will also put a temperature probe. We tend to use an esophageal temperature probe, which is a probe that we put down in the food passage, which allows us to measure temperature more accurately. And also a forced warm air heating blanket, which is a more effective way of keeping you warm during the surgery. Invasive monitoring is what it says. It's more invasive than the routine monitoring, and because of the complexity of the surgery and the amount of fluids, blood, and changes that will occur during your surgery, it is necessary for us to monitor in a more invasive way. Now, what does invasive monitoring mean? It means that we will place special catheters in larger blood vessels and in your arteries to allow us to gather information that helps us make decisions along with the surgical team during your surgery. For most times we use the artery in your wrist, or we use veins in your neck. And these catheters, with few exceptions, are introduced after after the anesthesia has been started. Should it be necessary because of your health problems to place any of these devices prior to being induced for anesthesia, we will give you lots of sedation so you'll be relatively comfortable while we're placing these catheters. Now, transesophageal echo probe. This is a probe that is used infrequently for this type of surgery, but should your medical conditions allow us to consider more direct measurements of your heart, it is a device much similar to, if any of you have had studies of your stomach where they put a probe down in your stomach to take pictures. This is a similar type of device. It is done after you go to sleep, and it allows us to take pictures of your heart and measure certain physiological variables. It is infrequently used, but if it is, we will go over that with you at the time of your visit. The other concern for this type of surgery is the management of pain postoperatively. It is lengthy surgery, and you will encounter discomfort after the surgery, and so it is necessary for us to discuss this with you prior to your surgery. The management of pain has changed significantly over the years, and it's gone from intramuscular injections of narcotics to patient-controlled devices, which you will still have during this surgery, and it allows you to press a button and give yourself a dose of medication. In some instances, epidural catheters are used, and these are catheters that are placed in the epidural space in your back, which will allow us to use local anesthetics to control your pain postoperatively. Here at Shadyside, where we do most of these procedures, we have an acute pain service that will work closely with the surgical team. They will see you preoperatively and follow you postoperatively. They will place catheters in your back prior to coming to the surgical suite, and these will be injected with medication at the end of your surgical procedure, and they will be used for the first 2 or 3 days after your procedure. Now, this allows us to reduce the amount of narcotic medication and other pain medications that you need to control your discomfort. Now, this is associated with multimodal therapy. Now, what is multimodal therapy? This is a combination of the pain catheters, as I just mentioned, with other medications to enhance the effectiveness of the blocks and also to interrupt other pathways contributing to postoperative pain. Now, when we talk about anesthesia, you may experience some complications or side effects postoperatively. There are minor ones and there are major ones, and in many instances, people may experience nausea and vomiting. They may experience a headache, muscle pains, sore throat, and on occasion, dental injuries. And these are minor, they are a nuisance, they are troubling, but they will get better. There are major complications related to your heart and lungs, drug reactions to medications that you are given, airway problems, and on occasion, death. We will discuss each of these with you in as much detail as you wish at the time of your visit. Now, When will you get an opportunity to see an anesthesiologist? In most instances, it is the day of surgery. If you were admitted to hospital for this surgery, or if you're from out of town, we will see you the night before in hospital. But if you are admitted on the day of surgery to be operated on and then admitted post-surgery, then we will see you the morning of surgery. For anybody that would like to discuss the surgery and anesthesia with us prior to the day of surgery, if you are admitted on that day, we would like to make that as easy for you as possible through our Shadyside office. And this could happen, either have your surgery department or surgeon office call our department and have one of us call you. And we could either do this on the phone, or we can arrange an appointment for you to come into the office and we could discuss this with you. If possible, if you're out of town and you're visiting your surgeon and you have the time, we could probably easily arrange to see you on that day. We would like to make it as convenient as possible to do this at a time when it is comfortable for you to talk about problems and at any point in time. Thank you.